Lichen planus, LP, is a chronic inflammatory disorder that affects the skin, mucous membranes, nails, and hair. It is characterized by itchy, flat-topped, purplish lesions that can appear anywhere on the body. Although the exact cause is not fully understood, lichen planus is generally considered an autoimmune condition, where the body's immune system mistakenly attacks its own tissues. It is not contagious and can occur in individuals of any age, though it is most common among middle-aged adults. Causes and risk factors. The precise cause of lichen planus remains unknown, but researchers believe it results from an abnormal immune response. The immune system's T lymphocytes attack skin or mucosal cells, leading to inflammation and cell damage. Several factors may trigger or contribute to this immune reaction, including autoimmune disorders. People with other autoimmune diseases such as lupus or alopecia areata may be at higher risk. Genetic factors. A family history of autoimmune or inflammatory skin diseases can increase susceptibility. Medications. Certain drugs, such as those used to treat high blood pressure, arthritis, and malaria, can induce lichen planus-like reactions. Infections. Hepatitis C virus infection is strongly associated with LP, particularly with oral and genital forms. Allergens and chemicals. Dental materials, like amalgam fillings, dyes, and certain metals may act as triggers. Stress. Emotional stress and anxiety may worsen or trigger the condition in susceptible individuals. Symptoms and appearance. The symptoms of lichen planus vary depending on the affected area. The most common presentation involves the skin, but the disease can also affect the mouth, scalp, genitals, and nails. Skin lichen planus. The hallmark sign is the presence of flat-topped, polygonal, purple, or reddish-purple papules that are often itchy. Lesions frequently appear on the wrists, ankles, lower back, and forearms. The surface of the lesions may show fine white lines known as Wickham striae. In some cases, scratching leads to new lesions, a phenomenon called the Koebner response. Oral lichen planus. This form affects the mucous membranes inside the mouth. It often presents as lacy white patches or painful erosions and ulcers. Burning sensations, discomfort while eating spicy food, and sensitivity are common. Chronic oral LP carries a small risk of transforming into oral cancer, so long-term monitoring is important. Scalp, lichen planopilaris. Causes inflammation around hair follicles leading to patchy hair loss and scarring. The scalp may appear red, scaly, and painful. Nail lichen planus. Nails can become ridged, thin, or split. Severe cases may result in permanent nail loss. 5. Genital lichen planus. In men, it can appear as white patches or purple lesions on the penis. In women, it often affects the vulva and vagina, causing pain, redness, and erosions. Diagnosis. Diagnosis of lichen planus is primarily clinical, based on the appearance of the lesions. However, confirmation often requires skin biopsy. A small tissue sample examined under a microscope shows characteristic inflammatory patterns. Direct immunofluorescence test helps differentiate LP from other similar skin conditions. Blood tests may be performed to check for hepatitis C or autoimmune markers. Patch testing, used when a reaction to dental materials or chemicals is suspected. Treatment and management. There is no permanent cure for lichen planus, but treatment focuses on controlling symptoms, reducing inflammation, and preventing complications. The condition often improves spontaneously over time, particularly the skin form, which may clear within 1 to 2 years. Treatment options include topical corticosteroids, the first-line therapy for reducing inflammation and itching. Oral corticosteroids, used in more severe or widespread cases. Antihistamines, help relieve itching. Immunosuppressive drugs, such as cyclosporin or azathioprine, for resistant or severe forms. Retinoids, vitamin A derivatives used topically or orally to promote healing. Phototherapy, Exposure to ultraviolet, UV, light can be beneficial for some patients. Mouth rinses or gels, in oral LP, medicated rinses containing corticosteroids or anesthetics reduce discomfort. Lifestyle adjustments also help in management. Avoid smoking, alcohol, and spicy foods if oral lesions are present. Manage stress through relaxation techniques. Maintain good oral and skin hygiene. Regular medical check UPS for monitoring, especially in oral LP cases. Prognosis and complications. For many individuals, lichen planus is a self-limiting condition that resolves within months or years. However, mucosal and scalp forms tend to persist longer and may cause complications such as scarring and permanent hair loss, in scalp involvement, chronic oral pain and difficulty eating, risk of oral cancer, in long-standing oral LP. With proper treatment, most patients achieve good symptom control and can live comfortably. Conclusion. Lichen planus is a multifaceted inflammatory disease with variable presentations. Although its exact cause is unknown, the immune system's overreaction plays a central role. Early diagnosis and appropriate treatment are crucial for symptom relief and prevention of complications. While there is no definitive cure, medical management, lifestyle adjustments, and regular monitoring allow most patients to lead normal, healthy lives.